السلام عليكم. Our lecture today is
عليكم
about
السلام، تفضل بابا.
brain vasculature. Brain vasculature, the entire blood supply of the brain and the entire blood supply of the brain and the spinal cord depend on the two sets of the branches from the dorsal aorta. The first هو vertebral artery arise from the subclavian artery and the internal carotid arteries are branch of common carotid artery. The brain receives about 15% of resting cardiac output and account for 25% of the body O2 consumption. 10 seconds of brain ischemia clinically, we're talking clinically, 10 seconds of brain ischemia lead to unconsciousness. 20 seconds of brain ischemia sees electrical activity of the brain. 3 to 4 minutes of brain ischemia lead to irreversible brain damage. The internal carotid artery is one of the two terminal branches of the common carotid artery, which supply the intracranial structure. In most cases, the carotid bifurcation occurs between the level of C3 and C5 vertebrae, or between level of hyoid bone and upper border of the thyroid cartilage. The internal carotid artery is divided to 7 segments according to the pathway of its pathway, and each segment gives branches. The first segment extends from the bifurcation of the common carotid artery in the neck to the inferior level of the skull base. The second segment is called the petrosal segment, is located within the petrous carotid canal of the temporal bone and has two small branches, the median artery and carotid artery of the middle ear. The third segment is the called lacerum due to its pathway due to the lacerum, a short portion superior to the foramen lacerum that extends from the petrous apex to the cavernous sinus. The fourth segment is located within the cavernous sinus and has two major branches, the meningohypophyseal trunk, which supply the pituitary gland, dival dura and tentorium via basal and marginal, which supply cranial nerve and dura of the cavernous sinus via cavernous sinus and meningeal branch. The fifth segment in yellow, the fifth segment is the glenoid segment, course within the anterior portion of the cavernous sinus until it exists superiorly into the cranial cavity. The sixth segment is the first segment in the intracranial subarachnoid space and has two branches, the ophthalmic and superior hypophyseal artery. And finally, the seventh segment extends superiorly to bifurcation of the internal carotid artery into the anterior cerebral artery and middle cerebral artery. Here, the branches of each segment, as we mentioned previously. C1 cervical segment and the first second segment and third segment, fourth segment, lateral segment, 5 segment, 6 segment and 7 segment اللي هي تقسم بعدين إلى anterior cerebral artery and middle cerebral artery. Anterior cerebral artery, this arises from the internal carotid artery of the anterior perforated substance and passes anteriorly superior to the optic chiasm. It winds around the geno of the corpus callosum and passes posteriorly on its superior surface to supply the medial and superior lateral aspect of the cerebral hemisphere. This is the anterior cerebral artery, and this is the branches. A branch of anterior cerebral artery is recurrent artery of Herben and anterior communicating artery. Anterior cerebral artery branches is the anterior communicating artery, and the other branch is recurrent artery of the Herben and the frontobarlar artery, orbitofrontal artery and frontopolar artery, colloso-marginal artery, opericallosal artery, and central branches. This travel of the corpus callosum. And the middle cerebral artery, this is the largest and most direct of branch of the internal carotid artery, and is therefore the most prone to embolism. It passes laterally and ends as a branch of the insula, the overlying opericula, and most of the lateral surface of the cerebral hemisphere. This is the pathway of the middle cerebral artery. And it's the branches of the middle cerebral artery with the area supplied. The second segment of the vertebral basilar system is the vertebral arteries. The vertebral artery arises from the subclavian arteries and then medullary arteries that arise from segmental branch of the aorta provide the primary vasculation of the spinal cord. This medullary artery is joined to form the anterior and posterior spinal arteries. Loss of the posterior supply generally lead to loss of sensory function, whereas loss of the anterior supply more often cause motor deficit. This artery enters the cranial cavity through the foramen magnum. Each of it gives rise to three main branches: the posterior spinal artery, as we mentioned in the spinal cord, and the anterior spinal artery, posterior and inferior cerebral artery supply posterior and inferior aspect of cerebellum. The vertebral artery that join anterior spinal artery and posterior inferior cerebral artery and the vertebral artery. The branches of the vertebral artery, meningeal branch supply bone and dura in the posterior cranial fossa, posterior spinal artery and the anterior spinal artery that supply the spinal cord, posterior and inferior cerebral arteries are the largest branch of vertebral which supplies cerebellum, medulla oblongata, and choroid plexus of fourth ventricle, and medullary arteries to the medulla oblongata. The basilar artery, the right and left vertebral arteries unite at the junction between the medulla and bones to form the basilar artery. It gives rise to the following branch: anterior inferior cerebral artery, superior cerebral artery, pontine artery, labyrinthine artery, and posterior cerebral artery. The brainstem and cerebellum and occipital lobe are supplied by vertebral basilar artery. This is the vertebral artery joining the one within basilar artery and the branches of basilar artery. The branches of basilar artery: pontine artery, labyrinthine artery, anterior and inferior cerebral artery, superior cerebral artery, and right and left posterior cerebral arteries. The basilar artery terminates by dividing into these branches. Posterior cerebral artery is the terminal branch of the basilar artery. It mainly supplies the occipital lobe, the inferior medial surface of the temporal lobe, midbrain, thalamus, and choroid plexus of the third and lateral ventricle. The posterior cerebral artery takes part in the formation of the cerebral artery of Fills, circle of Fills. This is the posterior cerebral artery and this pathway and the anastomosis. Now we talk about the circle of Fills. It is an arterial circle at the base of the brain in the interpendicular fossa. It's formed by anterior and medial cerebral branch of the internal carotid artery and posterior cerebral branch of basilar artery. The two anterior cerebral arteries are connected by anterior communicating artery. The middle and a posterior communicating artery of the same side are united by posterior communicating artery. In the pink color, as the mentioned. middle cerebral artery branch and the internal carotid artery with anterior communicating artery and posterior communicating artery. Radiological feature of the arterial supply of the CNS. Plain radiograph. The arteries are not visible unless calcified, as we know. This occurs most commonly in the carotid siphon near the pituitary fossa. Angiography of the carotid and vertebral system. This can be achieved via the aortic arch by a single femoral artery injection. The internal or common carotid artery are catheterized in the turn and view of both vertebral arteries, are usually possible via contrast injection into one vertebral artery, which retrograde filling of the other form of posterior artery. CT and MRI. Contrast enhancement aid visualization of vessel on CT scanning. Vessels are usually visible without contrast on MRI. Vessels in the cistern are particularly well seen on T2 weighted image because of the difference between the relaxation constant of CSF water and that of the vessel wall. MR angio allow direct visualization of the circle of pulse and its branch without contrast injection. Ultrasound examination of the neonatal brain. One neonatal ultrasound of the brain on the neonatal ultrasound of the brain, the collagen sheath of the vessel give them echogenicity. On real-time studies, pulsation of the middle cerebral vessels can be seen in the incident. The anterior cerebral artery can be seen in the interhemispheric fissure on coronal scanning and on parasagittal scanning. Pericorrosal and colloso-marginal arteries might be identified. This image shows the pericorrosal artery and the anterior communicating arteries with the posterior communicating artery and all circle of pulse. Due to the anterior fontanelle examination by probe, convex probe, we do vascularity of the circle of pulse. Venous drainage of the brain. Dural venous sinuses are venous channels located intracranially between the two layers of the dura mater, endosteal and the layer and pharyngeal layer, and can be computerized as trapped epidural vein. Unlike other veins in the body, they run alone and not parallel to the arteries. This receives blood from the brain and the scalp, the diablock vein, and communicate with the vein of the scalp and face, called emissary vein. They are valveless, without valve, allowing for bidirectional blood flow from and into intracranial veins. Together, the dural venous sinuses form the major drainage pathway from the brain, predominantly to the internal jugular vein. This is the emissary vein we mentioned, and the diablock vein. And the sinus اللي ذكرناها اللي supersagittal sinus with drainage into the internal jugular vein. This superior sagittal sinus, the transverse sinus, and the confluence of the sinus to the بعدين يروح internal jugular vein. Cavernous sinus. This sinus is on either side of the pituitary gland and the body of the sphenoid bone. Connect across the midline by intercavernous sinus. It is lie between layer of the dura mater. The internal carotid artery passes through this sinus with a sixth cranial nerve lateral and inferior to it. The third and fourth cranial nerve and the ophthalmic and maxillary division of the fifth pass along the lateral wall of the cavernous sinus. This shows the venous drainage of the brain. Superficial vein of the brain predominantly drain the cerebral cortex and include superior cerebral vein, inferior cerebral vein, and superficial middle cerebral vein, اللي هو called it salivary vein, superior anastomotic vein of Troland, and inferior anastomotic vein of Loewy. is the vein of the trunnion, ankyphloid sinus, sigmoid sinus, transverse sinus, draining to the internal jugular vein. Thank you.
عاشت ايدك دكتور يوسف، بس طريقة الإلقاء شوية ما تخلي الواحد ينجز.